Okay, are we ready to start? Whenever you're ready. Excellent. Well, welcome everyone to Dahdaleh Institute Global Health Graduate Seminar. And today we have Professor Godfred Boateng with us. He's going to do a presentation on resource insecurity and the socio-ecological determinants of health and sustainable livelihoods. And before I introduce Godfred, I'd just like to begin with a land acknowledgement. And this is a hybrid event. And so some participants are on different physical territories. So please, if you're not with us in person, just take a moment to give thanks and gratitude and respect to the land that you are on and that you're currently working on. And today we are gathered here physically on the York University campus in Toronto. And York University is situated on the traditional territorial area, which is known as Takaranto. And we acknowledge its current treaty holders, who are the Mississaugas of the Credit First Nation. And we also acknowledge that this is the traditional territory of many Indigenous nations, including the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and of course the Métis. And this territory is subject to the Dish with One Spoon Wampum Belt Covenant, which is an agreement to peaceably share and care for the Great Lakes region that we are in. And so with that acknowledgement, I think it's actually a perfect introduction to Godfred's description within the context of planetary health. And Godfred is, well, frankly, he's a great colleague and a person who brings great care and attention to his research. And most especially, I think, is what I've seen, he's incredibly dedicated to student learning. And that is, boy, that's a treasure. And especially today in most academic institutions, it's actually increasingly rare that you have professors who are genuinely committed to student learning. And Godfred is amazing in that regard. He's also occupies a very esteemed position within academia. He's a Canada Research Chair in Global Health and Humanitarianism. And he's director of the Global and Environmental Health Lab here at the Institute, and a faculty fellow also here at the Institute. And he's an expert in designing and applying culturally relevant and scalable methodologies. And he does this with a view to understanding the multidimensional factors and processes that shape health of individuals and communities, and also health equity and inequity across spatial scales, so across time and space of different parts of the world, and also with different operational parameters in terms of how those spatial scales are conceived. So, for example, he thinks about household, community, institutional, or national structures and forces and factors that shape equity and inequity. And his focus is on resource insecurity and its impacts on health. And his also focuses on sustainable livelihoods and their impact or relationship to health and health outcomes. And then the socio-ecological determinants of health, and particularly he's interested in cardiometabolic conditions in aging adults. It's very unusual, actually. Most researchers are very focused on youth and on the general population. Godfred is one of the few researchers that actually focuses on aging populations, and probably one of the handful of researchers that focuses on aging populations in the global south. Yeah. So really, really a special researcher and a special thinker. He has great expertise. He's a sociologist with incredible expertise in quantitative data analysis and highly skilled in survey scale development and in, again, quantitative analysis using inferential statistical methods. And I can tell you all kinds of great and very impressive things about grants and things like that, which academics seem to hold with great value. But there's a long list. That's all you need to know. He, very importantly, he's a lead associate editor for a special issue on measuring health inequalities among vulnerable populations in the International Journal of Environmental Research and Public Health. It was quite an important journal because it really helps us advance our thinking and our way of approaching the measurement of environmental forces and factors that shape human health. So with that, I mean, I could go on, but I think that kind of gives you an idea. This is a serious person who really cares about what he's doing and also is very committed to teaching in its purest sense. So with that, Godfred, over to you.
Thank you so much, James. It's exciting to be here again to present various aspects of my work to the team. And I'm always grateful to the Dahdaleh Institute for all the support given, especially for supporting my CRC, because it plays a key role to the work I do, and it gives me room to do a lot of research. So as you rightly heard, I'll be presenting on resource insecurity, the socio-ecological determinants of health and sustainable livelihoods. And I'll be drawing some connections between resource insecurity, what we term socio-ecological determinants, drawing on the framework, and then connecting it a bit to sustainable livelihoods and linking it also to the sustainable development goals. And this presentation will draw from my research and some of the interesting findings we have made. And so on the whole, this is kind of the structure I've given to the presentation. Hopefully time would allow because we have limited time. And so I'll go through this. I'll kind of give you a sense of how I frame my research in the light of systems thinking, and then run through the various items you see on the screen. Okay, so I'm sure you've seen this somewhere, someplace, sometime. And in an era of polycrisis, it is important to understand the complex issues we deal with, the complex factors that impact the global commons. And I brought this up, blind men and the matter of the elephant, to depict something, right? So this has been narrated in different ways, but I'll present my version this afternoon, right? So its origin is somehow from India, some other place, but I'm not sure of it. But what this story is about this king who beseeches a land of the blind with his army and seeking to amaze them, presents them with these huge elephants. Remember, they are blind. They have no knowledge of what is going on. And so 6 of them hurriedly get to the elephants, trying to have a feel and have a sense of what an elephant is, right? And so you find that the first then goes on to touch the tusk and feels like it is sharp and thinks in some ways they should be a sphere, right? So the notion of an elephant is likened to a sphere. The next goes on and touches the ears, and it's broad and it's rugged and thinks it's a fan, or in some sense, it's like a rag. Another touches the trunk and feels like it's hollow and it's long, and it feels like a snake. The fourth person touches the tail and feels like it's a rope, right? The next person touches the legs and feels like it's a tree or a pillar of a sort. And the last person touches the body and feels like it's a wall, right? What you do see here is a sense of individuals who are looking at the same thing from different perspectives. They do not have the same story. They do not have the full story. They have half truths. They do not have the full truth. And so they can be fully right, they can be fully wrong, right? And that tells you how complicated it is to be able to examine some of the issues we are dealing with, especially when we are blindsided, when we do not have all the information. Such is a problem we are faced with when you even think of resource insecurity, especially from a systems thinking angle, where we can sometimes think of parts and not the whole system, right? You have part of it, but depending on what perspective you come from, you might be wrong, right? And then you have the different relationships, because I imagine if they were working together to look at the relationship between what they were seeing, they could possibly figure out that this is a much bigger thing we are dealing with, right? And so they need to be able to, one, look at the relationships, they need to be able to look at issues at a complex level as wholes. And the fact that you could look at these whole systems on different parts, and the parts by themselves are systems on their own, right? And being able to make distinctions, this will form the basis, or more or less the basics of what I believe systems thinking is about, right? But there are those who specialize in that field, so I'll not go deeper into that. But that forms the basis of how I look at resource insecurity. You see, it's a complex and a multifaceted concept that consists of resource scarcity, resource access, lifestyle concerns that have the potential to impact the survival and the sustainability of both human and non-human species. And so resource insecurity, as you can see at the top, seem to be broad, but we have some knowledge of what access might look like. We have some knowledge of what lifestyle concerns, and sometimes we talk about anthropogenic activities that seem to drive climate change and some other factors that are harmful to the human race. But when you think of resource scarcity, you can look at it from three angles, right? One, looking at it from the minimalist lens, where it is about the availability of the needed resources, natural resources, to satisfy just about the basic needs of men. So you are looking at shelter, you are looking at food, you are looking at energy, you are looking at water. But from the moderate perspective, it has to do with the availability of resources to satisfy consumption at current and higher levels. And so no longer are you looking at it from the individual perspective. You may end up looking at it probably from the national perspective and to some extent the global perspective. But then even at the maximalist lens, or looking at it from the maximalist perspective, you are looking at scarcity in terms of actual demand over supply, right? Do we have enough to satisfy the demand available? So in a whole, you are looking at, when you think of resource scarcity in the context of resource insecurity, you are looking at a decline in availability, in the quantity, in the quality, in the efficiency, or to some extent, the accessibility of what one might consider to be the current needs that are not able to measure up to the demand that is required in society. And this has implications for our survival. It has implications for how sustainable something could be. And so when you think of my research, I look at resource insecurity, at least 4 components of it, and some of you may have seen this slide before, looking at food, water, energy, and housing insecurity. And this will be considered sustainable if households can cope with and recover from the stresses and the shocks and be able to maintain or enhance these resources both now and in the future, far not undermining the natural resource that they have now, right? But let's look at this in relation to sustainable livelihoods, right? When we talk about sustainable livelihoods, what are we looking at? We are looking at being able to consider factors that constrain or enhance livelihood opportunities. That's what I look at, right? Are these factors, whether food, water, energy, or housing, constraining the opportunities that people have? Or are they rather creating opportunities for them? And to going beyond just the linear relationship of cause and effect. And you've heard it here, and probably James would have said it a number of times, that we may often look at things linearly, but they are not always linear, right? There are different ways, there are different perspectives, angles to it. And so looking at it from those angles, the multiple entry points helps you to be able to deal with the issue. And in this case, when you think of resource insecurity in this regard, it helps us address those issues critically. And then lastly, shifting from a more prescriptive approach to a context-specific approach that allow for alternative local perspectives. And here, I'll bring in the humanitarian context, where classically emphasis have been placed on looking at incidents, natural hazards as exceptions to the rule. And so humanitarian organizations go in to address those issues, and that is it. They deal with it and they are out. Meanwhile, there are a plethora of issues that people might be facing. And so from a more resilient approach, we're calling for us to see, let's say, food insecurity, water insecurity, as one of the challenges facing the people you are studying, and that is what I'm doing, so that we are not just taking into account food insecurity, deal with it, and that is why I find that though efforts have been made, we are still struggling to deal with it. And over the years, progress has been made, but the surge in climate-related activities, as well as the pandemic, seem to have eroded the kind of progress that have been made in the last 20 years. And so when we think of this, we need to be able to look at it again from a certain angle. You cannot deal with it all. And so from the socio-ecological perspective, starting from Yuri Bonfrebrenner's ecological systems theory, you do see how he looks at how external factors, environmental factors, ecological factors impinge upon the behavior of an individual. And so starting from the micro to the meso to the exo to the macro to the chrono systems, all of these have a way of impacting the behavior of an individual. It was from this that the socio-ecological model was developed, so that you have different levels nested within, right? And you can see that they are not separate, they are not eccentric, they seem to be more concentric. And so at the individual level, if you are thinking of food insecurity, you are looking at educational level, income level, marital status, their nutrition knowledge, food preferences, influencing whether they are food insecure or not. And that goes on to the interpersonal, looking at the family, the household level, organizational institutions, the community, and then policy level. And at the policy level or at the national level, the question is, what policies do we have that may be informing or influencing whether someone is food secured or insecure? So being able to look at this at these different levels then helps me to be able to determine where should I start dealing with the problem, right? So I'm not just examining the problem for its sake, but I want to examine it at a point and at a level where I can make a difference, okay? So that now takes me to having an understanding of where I'm starting from. I show in this slide factors that impact sustainable livelihoods and increase vulnerability to resource insecurity at the individual, at the household level, or at the national level, right? So you think of demographic trends such as urbanization, economic and population growth, which could reduce access or lead to shortage in food, water, energy, and viable housing. Similarly, external shocks such as extreme temperatures, drought, wildfires, floods could impact access to food, water, and clean sources of energy. Furthermore, seasonality of prices such as inflation or seasonality in access to products, as well as employment opportunities, all would lead to resource insecurity. But remember, these things, if you don't deal with the trends, the shocks, and the seasonality, then the question about sustainable livelihoods is not answered, right? And so this is how I link it to increases in resource insecurity. So this has given you a sense, the background to my study, okay? And so here again, I showed that population growth, urbanization, economic development, climate change, to a large extent lead to exploitation and sometimes an overexploitation of natural resources and its degradation, right? So think of these global environmental changes that have become characteristics of our everyday experience and how it is impacting on the lives of people. And let me just pick one angle. When you think of increasing temperatures, especially in the light of food insecurity, how it impacts on pollinators. Pollinators drive our food production. And so with an increase in temperature, you do find an increase in the death of pollinators. Yeah, these pollinators, an example is the bee that help with the pollination process, right? So with extreme temperatures, we also see a migration of pollinators from one place to the other because they are not surviving. Sometimes urbanization, which brings about economic development, housing, means biodiversity loss. They have to clear large swaths of land in order to make room for these housing. That also means that the habitats of these pollinators are being destroyed, which drives them away. So in the bid to solve one problem, you end up with another. That's the complexity we are dealing with, and sometimes leading to wicked problems, right? So with the extinction of pollinators, it impacts on biodiversity conservation, reduces crop yield, and threatens food security. So you can see how climate change and the other factors that surround it would impact on food insecurity. And I'm touching on food insecurity because we cannot go through everything. But in all of this, is the poor and the marginalized who tend to be more vulnerable to these environmental changes, right? They are dependent on these natural resources and ecosystem services. And so whenever there's a threat, it means that they suffer loss. Let me be specific on this. Climate change and food insecurity. The FAO, as a Food and Agriculture Organization, says that food security happens when all people at all times have physical and economic access to sufficient, safe, and nutritious food that meets their dietary needs and food preferences for an active and healthy life. However, the lack thereof is about food insecurity. But look at the different ways by which climate change impacts on food insecurity. It impacts on availability, right? When there is limited availability of food, it means that families, based on the research below, the Lancet paper, it shows that people resort to less nutritious foods, right? Which ends up impacting on their health. It impacts on accessibility, the ability to be able to patronize this. But behind all of it is poverty. Behind all of this is their inability to afford or secure any of the things that they seek. So it could be food, and this is for food, but it could also be water, right? If you look at the relationship between climate change and water insecurity, you can see there could be torrential rainfall that floods a place. With flooding comes contamination of the source of drinking water, which increases the risks of intestinal diseases, right? So it is from this that I draw my program, and we'll talk briefly of how we have measured food, water, and energy insecurity and the impact it has made. In the next 5 minutes, I should be ending. Right. So from this angle, we look at resource insecurity at a broader level, made up of food, water, energy, and housing insecurity. And I've gone on to look at it from an integrated approach. One, you cannot know what you cannot measure. And so being able to measure food insecurity has given us a sense of the kind of impact it is having on the lives of people. And so my own research at some time at the Northwestern University showed that it leads to a decline in infant cognitive development. So whether you are looking at fine motor skills, language skills, social skills, it has a way, or even gross motor skills, it has a way of decreasing the ability of children to grow cognitively. Similarly, we've seen different effects with the creation of the household water insecurity experiences scale, where water insecurity has led to increases in near-miss maternity cases. It has, because these women ended up carrying water for a longer distance. They reached home and they were hemorrhaging. And by the time they got to the hospital, if not for some, we cannot tell what saved them, but it was a near miss, right? And it has other consequences. So being able to measure help us to be able to assess the effect it has on these populations. Then we move on to household energy insecurity. So you can see that we know how to measure food, water, but now it had been a challenge for energy insecurity. So one, I've been able to secure a grant that is helping me to develop that, but we've already developed one on household energy poverty experiences, which would be able to help us quantify the effect of, let's say, energy insecurity, for now a proxy, on the health of populations. But let me show you how energy insecurity affects the environment, because often we do not look at it from that angle. Energy insecurity in a lot of the rural areas would result in the cutting down of trees, right? And so what you do see on the screen is that it leads to a loss in forest cover, loss in soil biota, habitat destruction, loss in herbal remedies, loss in flora and fauna, loss in the ingredients for pharmaceutical companies or pharmaceuticals. And then you can talk about the quality of life. And so having been able to develop a scale of the sort, we've been able to assess the impact on these populations. We've seen economic, fiscal, psychosocial, behavioral, and the nutritional effect it has on women, infants, and children, right? And we've been able to compare these effects across two countries, in Ghana and in Nigeria, right? So from that, we've also gone on to look at various pathways by which it impacts on this same population, women, infants, and children. And you can see the effects have been quite significant. So seeing these effects should begin to draw our attention to how do we deal with this. In the integrated fashion, we had looked at food, water, and energy, but we had not looked at housing. So then the focus was to look at housing insecurity, look at the syndemic relationships that exist between them and how they compound the compounding effect they have on these populations. And similarly, we found these effects. The fact that housing insecurity increases poor mental health, it increases food insecurity, increases energy poverty, increases water insecurity, increases the risks of intestinal diseases. So knowing all of this, how do we deal with it? So I'm going to show you two examples of how we've gone about this in the past. So sometime, my time at Cornell, I'd worked with Dr. Rachel Beznake, who is still there, and an intervention using an agroecological approach. And an agroecological approach would require the use of the natural resource to help out in dealing with whatever challenges they may be facing. So using the same environment to be able to mitigate the challenge, right? And so here we experimented with intercropping, legume diversification, and the addition of compost, manure, and crop residue to the soil, right? And that is supposed to improve the soil instead of providing these people with, let's say, genetically modified seeds, which I have my own perspective about. But you can see that from there, from A, what you see in A is maize intercrop with glycida, right? And that is a nitrogen-fixing tree. Sorghum, an indigenous drought-tolerant grain for crop diversification in B. Then when you come to C, you have cowpeas for crop diversification and soil nitrogen fixing. Then pigs for integrated crop livestock systems, which provide income for the farmers, but also manure for the soil. Then you have in E, legume intercrop for nitrogen fixing. Then you have in F, legume intercropping for crop diversification and soil enrichment. And then lastly, this addresses energy insecurity. Efficient stove made of clay reduces firewood dependence and forest depletion. The second, which is ongoing, is to address water insecurity. Having received some funding from the Canadian Foundation for Innovation, we've been able to secure a Qualilet system quantitrade system that now helps us to be able to quantify the amount of coliform bacteria in water. So it also tells us whether there is fecal matter in the water. Using this, we are now able to identify households that are at risk of intestinal diseases because these particles or these pathogens are found in their water systems. What do we do with that? And so now, working in collaboration with Dr. Fred's lab from engineering, we've come up with these ultraviolet emitting belts, right, UV LEDs, for disinfecting or for water disinfection, also for the containers they use, disinfecting the containers. We are yet to roll it out, but the goal is that after we have identified households that have these pathogens in their water, we have this as a community-based project where they can go and collect the water knowing that their containers are disinfected and the water they are carrying do not have any of the pathogens. How are we making it sustainable? Because it needs to be connected to a source of power, we are now integrating a solar panel system that would help it run without the need for that power. Hopefully, the goal is in a year or two, once we roll it out and we are successful, we can extend it and have people pay just small amount of money, not for profit, but to be able to replace the lamps in the system, right? So when you take this approach, then you can be sure that you are safeguarding the health of the people, and you want to make sure that for years they have better systems to keep them going. So essentially, I mean, I've talked about how we need to examine the global challenges from at least a systems thinking lens. Right, so we do not approach it as a silo. We do not approach the issues as though they are not related to others. I've talked about how global environmental changes produce a resource insecurity with deleterious consequences for the poor and the marginalized, how measurement of resource insecurity, whether food, water, or energy or housing, can help us quantify and understand the various pathways by which they impact on the health of people, and then how addressing resource insecurity may be linked with the Sustainable Development Goals. Thank you.
Thank you, Patrick. Yeah. That was great. Very practical. At the same time, you gave us the principles, the framework, the principles, and then some very good examples. And I think what I like the most about it is that final line: identification of problems should go with, should be accompanied by sustainable solutions. And the way you've approached this, it very much exemplifies the thrust, if you will, of the Institute, which is critical problem solving for greater effectiveness, equity, and excellence in global health. And so just to kind of illuminate that just a little bit, you know, critical, it means shining a lens or a light into the crevices of a problem so that we better understand, we better see, we better know the dimensions of a particular problem. It's not problem definition with limited methodologies, i.e. linear approaches to cause and effect. But in this particular case, as Godfred I think has very nicely illustrated, it's recognizing the complexity of a particular phenomenon and being open to discovering new complexities that weren't previously seen. So that's what critique is about. That's what critical theory is about. It's about opening up a new understanding. and perhaps sometimes in ways from different access points, which is what Godfred emphasized early in his presentation. Identifying through those different access points apparent ambiguities, paradoxes, uncertainties in our prior understanding of a particular phenomena. So that's what critique is, or critical theory. But critique or critical theory, it's not enough, right? Critique for the sake of critique is kind of, it's genuinely not helpful. It is often, at least to me, it's not helpful. It's often quite dispiriting for many people who are genuinely trying to understand something and genuinely trying to improve a particular phenomenon or situation. So to be critiqued without an intention to improve can be, again, it can, first of all, it takes a lot of energy and a lot of very limited resources to think about a problem. And in my view, in many cases, it's a misuse of the privilege that a person has, of the time a person has, and of the resources a person has at their disposal to think about a problem. Right? This isn't magic that by which these things occur or these resources are brought to bear. This is a decision at some meta level of society that you or your institution or your entity is somehow charged with the task of taking on a particular issue. So to critique without a view to proposing meaningful, testable interventions, I think, is a misuse of that opportunity. And so critical problem solving is really the kind of the thrust of what Godfred has put forward. It's an illumination with a view to proposing interventions that can be tested and evaluated, so that in the next iteration of the application, there can be further improvement. And the goal or the principles by which the work that Godfred has described can, in my view, be summarized in those three sort of the triple E's: effectiveness, equity, and excellence. So whatever you do, you're trying to be effective. You're trying to actually have a meaningful, positive effect on the circumstances that you're trying to understand. And then the other is that the other key is equity, that all people should be treated equally. Or I shouldn't say equally, that's not correct. All people should be treated with a view to justice and fairness, and so that the most vulnerable are appropriately targeted and supported. And that may not be equal, right, to what people who are less vulnerable are subject to receive in terms of support and intervention. And that view that we focus on the most marginalized, the most vulnerable, are those who are subject to the greatest risk of a hazard, be it in any of the areas that Godfred has described. They're the people or the communities that should receive the most attention and the most resources in terms of how we think. And then finally, excellence, that we're committed, to excellence in how we approach a particular problem. That there aren't double standards. There's no double standard for the rich, the poor, the white, the black, the male, the female, the gay, the straight. There's no double standard. There's one standard. It's a standard of excellence, and that we pursue the best that we're capable of pursuing. And I think what Godfred has described is fantastic, and that's why we're when he came to York, just only a couple of years ago, it's not long. It was I was delighted. I couldn't imagine a better researcher to conduct meaningful research, but also a better person to teach, to show people how to think about these things. So thanks for the presentation, Godfred. I have questions, but believe me, I have a lot of questions. But let's see how people react. Any thoughts, comments, questions, please? Yes.
Well,
absolutely.
so I found it very interesting because I'm generally.
Nice and loud from the end, yeah, because people, it's harder over here.
My apologies. I found it very interesting, is particularly since I'm very interested in the idea of capacity building. So that way, rather than purely humanitarian intervention, there's humanitarian capacity building as well. I found it interesting when you were pointing out that food insecurity is not merely access to food, but access to foods that people want to eat. And I was wondering if, because you said it was according to preferences, and then I was reading your slides and it was culturally and socially appropriate foods. Is there some minimum threshold that they're trying to, of diversity? Is that something that is like quantifiable, or is it very specifically case to case? Because I know just having enough food is only part of the issue. So I was wondering if you could speak more to like how do they ensure that there's a diversity of foods available?
Sure, and that. Thank you for that question. And that can be looked at from different perspectives, and the context also matters, right? And within the context of even the Canadian system, you could have individuals who may have access to food, but are insecure. And the reason is they do not have the foods that they prefer, right? And so you could make accessible food banks, which would be sort of a safety net for those who do not have it. Yet, the foods that are there will not satisfy their needs, right? And so, like I said, it's context specific, and being able to, in terms of intervention, often work with the people to determine what works for them is, I believe, the best approach. And that is why whatsoever solution you are preferring for whichever group, it needs to be co-created and co-designed. That way, the solution works for them and they are more likely to use it. And so if it has to do with food and what they are going to plant for the next season, you're going to work with them to get it done. In the context of Malawi, there was a farmer-led approach where the farmers dictated the approaches and they brought in the indigenous ways by which they had maintained their farmlands, right? And so integrating that with what we know in research made it easier for us to be able to push things forward. So that's what I would say. Context is key.
And then we'll.
First and foremost, thank you for such a great presentation. I just had a question with regards to the relationship between resource insecurity and governance. So in terms of like the architecture of existing governance structures, like where do they fit in the discussion that we're having today? And do you feel like this also has an impact on the increasing vulnerability of the global state? And then the second part quickly was you touched on resilient approach. Do you have examples of what a resilient approach would look like with reference to resource, like scarcity or insecurity? Okay, so I'll probably start with the last, because that's much easier. So in terms of a sustainable or taking a resilient approach, I think it comes with empowering the indigenes to know what they are capable of. And so in the light of with the example from Malawi, these farmers at some point were facing drought and they had challenges, but equipping them with skills, having a farmers training approach. So the farmers train other farmers. In that way, what happens is the knowledge easily spreads. And even when the researcher is not there, they are still able to continue with whatever programs have been put up, right? So that is more of a resilient approach, which means that the next time they are faced with any drought, they can fall back on that knowledge and build from there. They don't need anyone to come in, right? And that brings me back to the issue of, let's say,
the use of genetically modified seeds, which have its positives in the sense that you can think of bumper harvest at a goal. You can think of there's no need for pesticides because they are resilient in that manner. But these seeds cannot be replanted after they are grown, right? And farmers have talked about how it takes away from the soil and they cannot make use of it anymore, right? But the worst of it is it's not, in my view, at least, I may change my mind with later evidence. in my view, the seeds over time would have to be patronized. This is not, it does not promote resilience. It promotes dependence. It is not cost effective. It is, yeah, so that angle. Now, in terms of governance structures, when it comes to, let's say, food insecurity, I mean, it's a complex system. You cannot, you need the key stakeholders at the table to support it. And it is not always the case. It has often been a top-down approach rather than, I wouldn't say a bottom-up, or if you want a horizontal kind of setting to discuss some of these issues, that would be helpful. But the top-down approach does not often help because sometimes it leads to square pegs in round holes. That's how.
Go ahead.
Hi, thank you very much for the presentation. One of the major themes that I was picking up on is that you were talking about energy and housing and food and then Malawi and then Ghana, and you seem to be just studying kind of, almost seems like everything at some point. And so starting from that idea, it's something that as like early researchers, a lot of us are like saying are kind of pressured into focusing on like one thing at this time. And that can be not me. I have a great committee and great advisors. Thank you very much. But I know we can be focused down into something. So how did you go from an early career researcher that was also pressured to which I assume was also pressured to focus on one thing, to being able to go to just about, it almost sounds like you could go to just about any country and kind of start and do a research project on just about any development question. And then on the flip side from that, when you decide to do a project, how do you bring that down to your research proposal? Like, how do you choose that you're like, this year I'm interested in electricity or energy? Or like, how do you decide to switch from topic to topic or put them all together? How do you write that research proposal and focus it all back down to even now?
That's a good question. So the fact is that this way of thinking about research problems, this systems thinking lens, helps you to be able to understand what the problem is and the fact that it is related to other problems. And so I started with food insecurity, and we went on to look at water insecurity because they were related. Then I got to understand what systems thinking was all about. And then as I thought of food and water, I felt that they are not just isolated, but they are also related to energy. Households that are food insecure and water insecure are more likely to be energy insecure. And then later I felt, okay, they will be connected to housing insecurity. And so in that light, it made me feel that you cannot just look at one aspect. You need to look at how they connect with each other. They are related. Each one is a system, and each system can be looked at as a whole or as a part of something, right? And so then I could lump all of them together and look at them as resource insecurity. So that's how I moved from one end to the other. And that I find they are all interrelated and speak to the same issue, right? But when it comes to putting it together in an application or a grant application of a sort or a proposal you can't do all at the same time. And so I phase them out. So this is phase 1, phase 2, phase 3. And then how do you combine those together, right? And I think you can get funding to support A, B, C, and D. And at some point, you can get the funding to support having an integrated approach. And those are the steps I've taken. And fortunately, I've gotten some grants to support that kind of work.
James, we have one question from.
Oh, sorry, Rupshan and David. Go ahead, Rupshan.
Godfred. I really resonated with what you said about co-design and co-creation, but my question was about sort of the Venn diagram that you put up with the different areas of your focus of the resource scarcity and sort of the syndemic relationships between those domains. I was just wondering, from like a problem standing point of view, how do you address sort of the correlation of those two things occurring at once? Because I feel like, especially with what I've seen, problem solving seems to be very directed towards one thing, whereas the problem, like you said, could be addressed by different sort of factors.
Rapsha, thank you for that question. And it comes back to a new way of thinking about dealing with the problems. Because we have a study that has shown that the coexistence of food and water insecurity at the same time worsens psychosocial well-being, right? And so we have proposed in that paper, published in Social Science and Medicine, that there is need to not address the problems, especially when they co-occur in isolation. You need to try and address the underlying issue, the substructure of the problem, which would help you to be able to address those two. And in this case, if you think of food and water insecurity, it comes back to the economic livelihood, the ability to be able to secure some of these resources. If you're addressing food, then you need to address water, but which one comes first? And so our research has shown that if you can address water, water would address food, right? That is at least from the agricultural point of view. If you have water, they would have enough for irrigation systems. They'll have enough to deal with other things that just addressing food would not do. So kind of it gives you a new perspective as to how to go about dealing with the issues instead of looking at it again. If you're addressing food insecurity alone, it is more of a linear approach, right? Yeah.
So that's a very good example of how systems thinking and critical perspective with a problem-solving approach, a very good example of how you can actually make choices, right? So there is a very significant difference between food security and water security, and yet they're linked, and they're linked in a particular linear way, while they are part of a broader subsystem. So I mean, what a great answer. It's not just a package, oh my God, of big problems that are everything, everywhere, all the time at once, right? It's actually, there's a system, if you can understand that system of relationship and pattern, right? And that can help you decide how best to act, to behave, to make choices around what are the outcomes that one wants in a particular circumstance. Michael has a question.
Just
And we're
briefly.
just very brief because we're over time, so go ahead.
One characteristic that I think we've talked about with the systems is their complexity. But I think there's another dimension that I would like you to perhaps comment on, and that's the dimension of the dynamic nature of systems. Because as I like to say, the only thing that's permanent at all is change. So while you are preoccupied understanding the complexity. This complexity itself is constantly changing. So comment on it, temporality.
Yes, I do agree with you that these systems change, but that is why there is at least this wouldn't be the best of answers, but I feel like it requires a constant evaluation of what approaches you are using, right? So that it is not a one-time thing and it is not one solution fits it all. It is dynamic because every context differs, which calls for you to take a different approach in every setting. What works for North America, what works for Canada, to be specific, might not work for Ghana, right? And that is it. If you can look at it from that angle, then I believe you'll be addressing some of the dynamism that comes with these approaches and the solutions you are preferring. Yeah.
Okay, well, thank you very much.